The president has made a powerful statement about COVID vaccine misinformation. He says it's killing people. So we have Dr. James McDeavitt, Executive Vice President at Baylor College of Medicine, live to sort fact from fiction. Good morning to you. Thanks for being here.
Oh, good to be here. Thank you.
Let's start with one of the more, far out theories, you could say. This stat just came out this week that 20% of Americans believe there are microchips in the vaccines. What do you say to that myth?
What can I say? That's just completely false. Internet rumor. I don't even know where it sprang from. But again, do I have a study to show that they're not microchips? No, because it's so patently ridiculous. But that is out there, and there are apparently people that believe it. And I see people online that are sticking magnets to their injection site to somehow prove that they've been magnetized by the vaccine. There's just no fact or science behind that.
Okay. And doctor, another concern that is being shared all over social media, and this one, it definitely is concerning for parents and for any woman of childbearing age, that the vaccine causes infertility. Do we have studies disproving that?
Yeah, so that is a more serious rumor. It is not fact than the microchip rumor. But it is also completely false. And when we get into vaccine issues, there are very few things that I can say categorically are true or false. This is one of them that is categorically false. This started as an internet rumor, literally. It got legs in social media. There is absolutely not a scintilla of evidence that the vaccines can affect fertility in any way, nor is there any theoretical evidence how they could affect fertility. And moreover, there have been studies where people have actually looked at the uptake of virus or vaccine around different parts of the body, including the ovaries. And there's minimal uptake of vaccine. So that's just completely false. And people should not be delaying vaccination because of concerns about fertility. And more than that, if you get COVID-19, we know for a fact, not for rumor, for a fact that your risk of miscarriage goes up, that your risk of a bad outcome from COVID-19 goes up. So if you're trying to get pregnant and have a healthy baby, you should be vaccinated.
The CDC has also said another common myth is that people think that getting the vaccine can actually cause you to get COVID or test positive for COVID. Does the virus go into you with the vaccine?
No, and that also is not possible to get the COVID from the vaccine. Just doesn't happen. Now, there are, in the history of vaccines, there have been what have been called attenuated virus vaccines, where you take a live virus and you inject somebody and the virus has been weakened so it doesn't create the same level of disease. There are no COVID-19 vaccines that are live virus vaccines. So you're not getting virus. It is impossible to catch COVID-19 from the vaccination.
You're going to stick around and answer viewer questions in just a moment. And this myth is actually one of our most popular viewer questions that I'm seeing coming in on my phone right now. And that's, I've already had COVID. I'm not vaccinated. Do I still need the vaccine?
Okay, the short answer is yes. That is not quite the same categorical yes that I had for the infertility questions and the can I catch COVID questions. Those are clearly no. In terms of whether you should be vaccinated, yes. And the reason for that is the consensus opinion right now is that the vaccine, the immunity conferred by natural infection is not quite as robust as the vaccine, the immunity conferred by the vaccination. And importantly, prior infection with COVID-19 does not appear to confer much immunity to the Delta variant, whereas the vaccinations do. So if you have had COVID-19, I would still recommend, if you were my patient, that you get vaccinated.
And doctor, real quick, there is a time limit that you should wait, right, to get the vaccine after having COVID?
Yeah, generally you should wait 2 to 3 months after your infection. It will cause you no harm if you were to get it sooner than that. It will cause you no harm if you get it a little bit later. But again, if you're 3 months out from your infection, I would strongly recommend that you go ahead and get the vaccine.
Okay, and finally, that one last myth. I know you think this is a crazy one, but there are a lot of people out there who think the vaccine alters a person's DNA, and you emphatically say not true.
Not possible. So that is again just a flat out myth. It's not even something that people study. Like we don't study are there microchips. It's just not possible.
Okay, Dr. James McDeavitt with Baylor College of Medicine. He's going to stick around, folks, and answer your vaccine questions coming up after this break. Thank you, doctor. So a reminder, we're going to put that number back on the screen for you. Text the questions to 281-845-7535. He's going to answer them after this short break. Time to get your COVID-19 vaccine questions answered by an expert. Dr. James McDeavitt, Executive Vice President with Baylor College of Medicine, is back. All right, let's get right to it. We've got some good ones coming in. First question, if vaccinated, is it safe to not wear a mask around your baby or small child? And doctor, I think this is a good question because we've heard of breakthrough cases with mild or no symptoms. So, I mean, you could still have COVID and pass to your child not knowing you have COVID, even if fully vaccinated, right?
Yeah, it's a great question. And recall when the CDC changed their guidelines a couple of months ago now to say that if you're fully vaccinated, you can take off your mask, you cannot worry so much about distancing. That was based on observations of the virus, that if you're vaccinated, you're unlikely to catch the virus and you're unlikely to be critically ill. What has changed with the Delta variant, and this is mostly good news, you are still very, very well protected from the vaccine, so go get the vaccine. You are a little less protected in terms of getting the virus. You can still catch the virus and pass it on. The protection is still pretty good, but it's dropped from the 90% protection range down into probably the high 70s or low 80s. But you still have excellent protection against winding up in a hospital or an ICU. So you're unlikely to get sick. You're unlikely to wind up in a hospital. You might get flu symptoms. You might feel like you have a cold for a few days. So yes, theoretically, you can pass the virus on to others. My advice would be twofold. One is if you're going into crowded indoor environments, just be careful and try and stay out of places where there's a high density of people, poor ventilation indoors. Carry your mask with you. If you feel like it's an unsafe environment, put it on. I think that's prudent. In terms of children, if you're vaccinated and you're relatively safe, you don't have a ton of exposure, I think you're relatively safe being around your children. I wouldn't necessarily mask. And still children have they're less likely to catch the virus, and they're much, much less likely to have a bad outcome. A study just came out of Great Britain 2 weeks ago. The risk of mortality in a child under 18 is about 2 in a million. So it's a very, very, very low rate. So I would not be overly concerned about infecting your kids.
Okay, next question. If I got Johnson & Johnson, which is lesser protection, can I get the Pfizer or Moderna? We just had this NYU study we talked about all morning saying the J&J offers less protection against the Delta and a booster might be needed. But when will the J&J recipients be able to go get a booster and know it's safe?
Yeah, I would say for now, based on the knowledge we have, if you're vaccinated with J&J or if you receive both doses of Pfizer or Moderna, then you don't need a booster today. Now, a couple of big caveats there. If you, for whatever reason, chose just to get one dose of Moderna or Pfizer, then you need to get your second dose. And one of the nuances of the Delta variant is the one dose of Pfizer Moderna confers very poor protection against the Delta variant. So I would go out and get the booster. And in terms of the need for boosters at this point, the immunity seems to be pretty good. And I know Pfizer has applied for a booster. Keep in mind, the booster they want to give is the same vaccine you've already gotten. So it's not specific for the Delta variant. I think all the pharmaceutical companies are working on new vaccines for the emerging variants. So I think it's early now to be thinking about getting a booster dose.
Okay, and finally we got a question here from a person who says, I have not had the vaccine. I drink immune support tea every morning. I wear my mask when in public. This seems to be working. So why should I get the vaccine if what I'm doing is working?
You are not safe. and you're at higher risk now of catching coronavirus than you ever were. And the fact you haven't had it, it doesn't mean it's not coming. And I just finished maybe with a couple of statistics. I looked this week at Vermont and Alabama. Vermont is the most vaccinated state in the country. Alabama is the least vaccinated state. Over a 7-day period, Alabama had over 900 COVID cases. I'm sorry, Alabama had 900 and Vermont had 8. Alabama is admitting 65 patients a day. Vermont is admitting 0. There are 41 people in 7 days in Alabama who died of COVID-19. In Vermont, that number is 0. So the vaccines are highly effective. And even if you're 20s, 30s, 40s, if you've not been vaccinated with this more infectious strain of Delta, it's more important now than ever to go out and get your vaccine. And I say that both as your physician concerned about your personal health, but also the responsibility you have to protect the most vulnerable in our population. And as you mentioned before, our kids who can't get vaccinated right now.
Dr. McDeavitt from Baylor College of Medicine, thank you so much for all the time you gave us this morning, and hopefully we'll have you on again soon because we had a lot more questions from our viewers. Thank you to the viewers as well, and hopefully we'll get more of them answered throughout the month here. Thank you.
Always good to see you.
All righty, you too.